Trump's plan to work all of us to death is becoming a reality. Nebraska just became the first state in America to implement Medicaid work requirements. And I want to explain exactly what that means and what the data says it will actually do, and why this is one of the more cruel policies that this regime has produced, which is already a pretty high bar. So this policy, if you're between the ages of 18 and 64, you have no dependents under 14, and you receive Medicaid, you must now prove every 6 months that you're working, in school, or doing at least 80 hours of community service a month. If you can't submit the correct paperwork in the correct format by the correct deadline, your health insurance is terminated. And there's some data that tells us what this policy actually does. And the most comprehensive data that we have comes from the state of Arkansas, which implemented a work requirement briefly in 2018 before a federal judge struck it down. In the 9 months that the Arkansas policy was in effect, 18,000 people lost Medicaid coverage. Nearly 1 in 4 people that were subject to the requirement lost their coverage. And the key finding? The vast majority of them lost coverage not because they weren't working. They lost it because they failed to submit the paperwork correctly or on time. These people were working. They just didn't fill out the form correctly, and they lost their health insurance. Of all the ways to make a buck, right? And the Kaiser Family Foundation data shows that nearly 60% of adult Medicaid recipients already work. And among those who don't work, it's health limitations that are the primary barrier. So you have 60% already working. And to be clear, the requirement doesn't require them just to work. It requires them to prove they are working to a government system that is not designed to make it easy to prove. The CBO, the Congressional Budget Office, estimates that the work requirements will cost 11.8 million Americans their Medicaid coverage over the next decade. 11.8 million. And the research from Arkansas tells us that most of those people will lose their coverage not because they failed the work test, but because they failed the paperwork test. The CBO also found that Medicaid work requirements don't actually increase employment. They just save money by removing people from the program. And that is the whole point of the Trump regime. And then, to make it even worse, 6 states are planning to use AI to implement these work requirements, having computers interact directly with the people that are trying to keep their health insurance. So you're going to be arguing with AI over whether or not you can keep your health benefits. Arkansas, Missouri, and Oklahoma already have AI that will talk to Medicaid recipients and help them upload their verification documents. So the person who's working 3 jobs and can't afford to miss a shift to visit a government office will now have the privilege of talking to a chatbot about their eligibility, while their hours are being verified by an algorithm. And if you want to feel better about all of this, Dr. Oz, the administrator of Centers for Medicare and Medicaid Services, the man who spent decades promoting bogus supplements on television, said, "We don't like self-attesting. Documentation is critical." That's the man in charge of this program. The man who was essentially a snake oil salesman who couldn't document crap his entire career. And he's now in charge of implementing a program that could cost 11.8 million people their health care benefits. This program and policy is designed to encourage people to work. No, it's not. It's not. It's clear. It doesn't do that. All it does is reduce the number of people on Medicaid by making bureaucracy hard enough. And so people will fail and people will fall off the rolls. And that is the real accounting from the CBO. The Arkansas data proved it, and Nebraska and other states are doing it anyway. And the One Big Beautiful Bill requires all 42 Medicaid expansion states to implement this by January 2027. The full requirement could ultimately cost 5 to 10 million people their health care coverage. These are people who, by the CBO's own analysis, will lose coverage for filling out their forms wrong. And a reminder, this is all from the party that wants to cut $326 billion from Medicaid over 10 years, calling this promoting work. It's not promoting anything. The data proves it. And the data proves that we are gaining subscribers at a huge rate, and I cannot thank you guys enough. So if you are not among the subscribers, do me a favor, hit that subscription button, hit the notification icon. That way you will be informed every time we do a story like this one.